Good afternoon, good evening, everyone. Welcome to webinar 258. Such a delight to have all of you. This is a special webinar for me. It is number 358, and we have the very distinguished Dr. Josef Thomas, consultant psychiatrist, member of the CLI board, son of Donovan and Faith Thomas, as presenters. Much respect, Joe. Salute you. Proud of you. All the best. It is another youth night, and we have the very distinguished Marcie Auguste that will be moderating. When I think about these young people at the control, I say the future of Choose Life International is bright, and we welcome them so much. Look in the chat, I see many of you from all sectors in society. We ask you to send out the link, invite more. There's so much in store. This is our first presentation on this platform by the newly minted consultant psychiatrist, Dr. Josef Thomas. I welcome you on behalf of the Choose Life International family. Our mission in life is to help people live physically, emotionally, and spiritually. We extend our condolences to the parents and friends of and family of those who are mourning the loss of those loved ones in Jamaica and in the US and in different parts of the world. If there ever a time that the church and community needs to rise up and be proactive in helping people live, it is now. I use this forum to issue a call to the government of Jamaica, the government of the USA, the government in the Caribbean region, the leaders in nations to be more proactive about capturing what could be an epidemic, as over 720,000 people died by suicide last year. And for every person that dies by suicide, another 20 attempts, and probably another 100 persons have thought about it. It cannot be business as usual. The cries come from every sector in the society, and all of us need to recognize that we have a role to play. It is September, the last Sunday in September, and September is Suicide Prevention Month. I ask you, therefore, to make a choice to help people live physically, emotionally, and spiritually. There are many of you who have been helping people live, and I want to commend you. Commendation to the staff and volunteers of Choose Life International. Commendation to all of you who have labored long and hard to be able to have planned these webinars over this time, over these 5 years. We have been at it for 5 years through volunteer effort. Thanks to all who have coordinated, who have served as moderators, as facilitators. We are grateful. And whoever is singing, we are needing to mute somebody there. Just manage your mics, please. We are grateful for the many who have given up their time to just present, the many professionals who have been on this platform. We are grateful. You have not charged us, and that's why we've been able to keep going. We are grateful to the many who continue to give to the ministry of Choose Life International your time, your talent, your resources to be able to keep this ministry going. Can you imagine that we have had over 20 nations represented on the World Suicide Prevention Day seminar? People are concerned. People want to be proactive. We're grateful for the help we got to be able to translate into Spanish, into French, for the help we got with sign language translation. Over 800 devices were on. People want to be empowered to help. Yes, we have got to be deliberate, and I welcome you. Thanks to Jamaica Brothers Group, who remains our main sponsor for that event, and of such, we would like to be able to acknowledge them. Let's have the Jamaica Broilers ad right now.
You've tamed the voices in your head. You've put your courage to the test. Laid all your doubts to rest. Your mind is clearer than before. Your heart is full and wanting more. Your future's at the door. Give it all you got. No hesitating. You've been waiting all your life. This is your moment. This is your moment in time. This is your moment. This is your moment to shine, to shine, to shine.
Yes, yes, yes. I pick up the comment in the chat that says, even the church is impacted. Even in the church, this must become an alert for leaders also. I have a vision of hosting a town hall meeting in Jamaica on the 27th of October. If there's any support for that, I want to ask you to send me a private message in the chat. Let's do it for Jamaica. Let's do it for the nations of the world. Town hall meeting, public forum. We're looking some help to be able to do that town hall meeting from Kingston, Jamaica on the 27th of October. It cannot be business as usual. Faith, you have been so instrumental in just keeping the fire going, just keeping the webinars going. Welcome. Thank you so much for your invaluable support. I'm certain that you want to extend your word of welcome to all our participants tonight.
Hello, 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 everyone. It is good to be here again. Webinar number 358. Welcome to you all. I see some persons who look like it's their first time. If it's your first time, welcome to our forum. Welcome to our webinar. We do this every Sunday. And we want to encourage you to send out the chat, send out the link, because this is a very important discussion that we want to have today. So welcome, welcome, everyone. Have we prayed yet? All right, let's pray. Father, we thank you for today. We thank you that you are with us even on this webinar as we speak about depression, substance use, and gaming, internet disorder. Lord, we ask that you be very present with us and that you would take full control, guide the discussions, and cause that everything will redound to your honor and to your glory. Just steady everyone's nerves. Bless our speaker, our presenter, and glorify your name. We give you thanks in Jesus' name. Amen.
Thank you, Faith. Whether you're from Jamaica, from the USA, from the Cayman Islands, from Trinidad and Tobago, or Peru, I see Pepe Salem Jr. all the way from Peru. We shout out, hola, hola, hola. Welcome, great to have you. And Pepe has just sent us a great message saying how much they have appreciated the translation into Spanish as he mobilized people from Peru, Colombia, Venezuela, and Cuba for that event uh, on September 10th. And we are in partnership with him to see Peru CLI established. Wherever you are in the world, our mission is the same, helping people live physically, emotionally, and spiritually.
Spiritually. And you
Yeah.
know, Donovan, as you talk about the translation, let me specially welcome our guest today, Dr. Joseph Thomas. As you heard, he's our son, our younger son. And special welcome to you, Joseph. And Joseph was also very instrumental in making sure that the translation was flowing well on the internet. He was monitoring that area. So welcome, welcome, welcome to Joseph, Jody, and everyone.
Shout out to the Language Training Center of Jamaica who helped us with that. Do you believe what I'm going to tell you now? That we had 30 people in Malawi in a watch party, 50 in Tanzania, 33 in Rwanda, 41 in Burundi, 50 in Congo, 26 in Kenya, and 100 people in Uganda. And there may be people from Uganda on the chat right now. Shout out to all of you, wherever you are from. We are onto something. And we say, we are onto something that is orchestrated by God Himself. Ladies and gentlemen, let us do what we can to be able to rescue lives. Jesus come that we can live, that we can have life and life with abundance. But the enemy comes with an agenda to kill, steal, and destroy. And we have got to do what we can to be able to help people to choose life. It is my pleasure right now to introduce to you our moderator for today, young, dynamic, anointed woman of God, Marcie Auguste is a public health professional with expertise in population health and mental health. Born in Dominica, she developed a passion for health and well-being early in life. She completed her undergrad studies in culinary arts and hospitality management before pursuing a master's in public health. She is currently pursuing a PhD in healthcare management. Ladies and gentlemen, the chair of our youth webinars, Miss Marcie Auguste. Let's make her welcome. Welcome, Marcie.
Hi, Dr. Donovan. Hi, everyone. Thank you so much for joining today's webinar. Again, it is webinar number 358. We're getting up there. We have been doing this thing for over 350 times, and I can't wait to see us reach 1,000 and 2,000. And I love that the impact that we're making. We have people from Guyana, from Peru in the chat. So big up to you guys one time, wherever you're watching, from Facebook, Zoom right here. Just welcome, welcome, welcome. Today's webinar is pretty interesting because I like the topic. We're talking about the prevalence of depression, substance use, and internet gaming disorder and its correlation in a Jamaican high school. And when I tell you, I am most excited to learn what exactly is gaming disorder and what exactly, just some statistics about it and like the impact that it's had. That it has in Jamaica high school. And Dr. Joseph Thomas, he is a consultant psychiatrist and he's also on the CLI board. He is gonna be our presenter today. So just a quick short bio. Joseph, your bio is
Joseph,
so
Joseph.
Joseph. Correction. Joseph, your bio. Oh my gosh, what a bio. Dr. Joseph Thomas is presently a senior resident in psychiatry and a graduate from the University of the West Indies, where he earned a Bachelor of Medicine and a Bachelor of Surgery degree in 2018. He has had leadership roles from high school, where he was the president of Ardeen High School's Inter Schools Chrisland Fellowship and a Nearwood Southeastern Regional President. At the University of the West Indies, he was the Special Projects Coordinator and National Representative of Jamaica Medical Students Standing Committee. He focused on human rights and peace. In 2015, under his leadership, this group won the Project of the Year for their community mentorship program. He was also a block representative of Irving Hall UE. Dr. Thomas was a volunteer in Bolivia, a part of the Youth with a Mission Discipleship Training School. He's also, like I said, a board member of the Choose Life International since 2019, and he has a passion, just like his parents, to help people live a fulfilled life. Dr. Thomas, hi, how are you? Again, I'm super excited to learn more about your topic and learn more about what we can do as Christians, as young adults, as people, as young people, as vibrant Christians, what we can do to help break the stigma of gaming, that gaming disorder. That's very interesting, Dr. Thomas. I've never heard of it before.
Let me just jump in before Joseph speaks. Let's acknowledge his wife, Jody, Dr. Jody Fong Thomas, who is online too, and to just indicate that since this bio was updated, sorry, since this bio is a little outdated, that he is now working as a consultant psychiatrist with the government of Jamaica. Welcome, Joe.
Welcome, welcome.
Good afternoon, everyone. It is my pleasure to be here. Thanks, Marcie, for that introduction. And yeah, thankfully I have graduated. This is actually what I presented today was actually the research project that I did for my degree. And so I am currently a consultant psychiatrist. And let me just bring this up. But it is definitely a pleasure to be here.
Just a moment,
The
Joe. I'm gonna ask you to just put the country of your part, where you're from, in the chat for us, please. As some people have started that already. Just go ahead and put it in the chat. All right, Kwesi, welcome. Kwesi is Dr. Kwesi Grant is the regional director for Lausanne Caribbean. Welcome, great to have you, sir. Thank you. Over to you again, Joe.
All right, awesome. So Marcie, yeah, the focus of my study was actually on looking at the depression and the correlation with the substance use and internet gaming addiction. I will touch on internet gaming addiction a bit, but probably not as much as you'd want. But we can see how it is. All right. Should I begin? Everyone can see my screen?
Yes.
Yes, you're good to go.
All right, great. So I'm looking at the prevalence of depression and its relationship with substance use and internet gaming addiction in a Jamaican high school. I want to first shout out to my research supervisor. He was the person who really helped me with his project. This is Dr. Delahaye. It was an amazing task, or amazing job working with him, and without him, this would not have been possible. So thanks again, Dr. Delahaye. All right. So looking at the background, right? So we're looking at the reason why I pursued this study, right? So many persons in school were postulating have undiagnosed mental health challenges. And this may have been worsened by the COVID-19 disruptions. If you can think back, I'm sure you remember the times when we're all wearing masks, we're all under social distancing, we're in the house, you don't see a person in the other room for 2 weeks because they caught COVID. And what the thought is that during this time, students were increasingly exposed to concerning activities. Well, the lack of supervision made them smoke more or smoke, or made their way of coping, and also being involved in more games online, because remember, you weren't able to go outside, and so we're huddling, we're probably watching Netflix for 2 weeks. If you can think back and remember all the seasons of different shows that you watched during that time. Also, there are some persons who may have started to game and game more. And so the purpose of this was really to look at it on a post-COVID, a quote-unquote post-COVID setting, to see how it was affected, to see how the pandemic has affected students, right? And the whole aspect of this as well is that adolescence is at a high period of vulnerability, right? In Eric Erickson, he looks at this period and he says it's the time when they're having identity or role confusion. So you're finding yourself, and this is time at the time of COVID as well. It was just so difficult, and I would say difficult for everybody, but especially for our persons in high school, and also I would say persons with with mental states which were challenging, that pre-existing difficulties. And so a lot of the studies from COVID really show that person who had challenges from before, it really just amplified the challenges. And so
Yeah.
the purpose of the study was to really look at it. All right. The aim of the study was to identify the prevalence of depressive, gaming, and substance use symptoms, and its correlates in a Jamaican high school. Right. So before we get into that, right, we're going to be looking a lot on major depressive disorder, and I just want to have a quick touch on it so that we're all on the same page. Right. So to meet the criteria for a major depressive disorder, you have 5 or more symptoms in within 2 weeks, and these symptoms are occurring most times of the day, most days of the week, right? And so the 2 gateway symptoms, you call it, are the depressed mood, and loss of interest or pleasure. And so we need at least one of these before we can call it major depressive disorder. Right? And this is according to the DSM-5. All right, so all the symptoms having are weight changes, insomnia, so you're sleeping more or you're sleeping less. Number 5 says psychomotor retardation or agitation. So basically, person is moving more slowly than usual. They're talking slowly. They're down. They don't really want to talk. They don't want to share. They move much slower than normal, or they're more agitated. So they're talking more. They're maybe doing things more fidgety, more active, right? And so that's what number 5 is. Number 6, you have fatigue, right? So you have and low energy. You're not wanting to do anything. Feelings of worthlessness or guilt. You may also have decreased concentration, and you have suicidal ideations, which is thoughts of death or suicide. And looking at the prevalence, so the prevalence worldwide of major depressive disorder is 8%. And this was a study done by Short et al. In 2021. And that's looking at the criteria, as I mentioned before on the previous slide. There was also, when we looked at depressive symptoms, the depressive symptoms in a meta-analysis done by Short et al. Showed that the prevalence of the symptoms was 34%. And we'll mention that because we're looking a lot on the symptoms in the study I did. But also many times, as persons, let's say persons who are not professionals, they may not see the entire picture, and diagnose depression. But when you look at the symptoms, you can have an idea that someone may be struggling with depression, and it may create some questions to ask. And so it's also important to know what depression looks like. So as we move on, it says that by adulthood, 30% of these adolescents, this is what Shirley Tal was saying, that of those persons who have depressive symptoms, they further move on to have full-blown depression. Right. So the point is, if you can identify some of these symptoms and catch them early, then we'll be able to have a better outcome. Right. And then we're also seeing that in low and middle income countries, right, over 75% of persons who have these depressive symptoms and who have depression do not receive treatment. And so, that really goes to show the let's say the inadequacy of the current system that we have. And so there's a lot to do. And one of the main things is identifying persons to be able to give them help as best as we can. All right, so looking at the local data now, another one of my consultants at university, Dr. Lowe, she did a study showing that roughly 40% of adolescents had moderate to severe depression. All right, and this is a study in 2014. And then in McFarlane et al. Showed that 42% of suicide were adolescents. And this is in keeping with the general data, the worldwide population, worldwide data as well, that shows many, wouldn't say majority, but looking at from the geriatric population, so geriatric population and adolescents, yeah, 42% of suicide attempts were from adolescents. And then it's also seen that most of these persons who have suicidal ideation and suicidal attempts were girls. And then you have there's also a high depression. Depression is also comorbid with substance use. And this is in Jamaica, but it's also across the board. So in regards to my study, that I did, we did a cross-sectional study. And so this is really looking at a point in time. And my point in time, when we looked at it, was between February to March 2024. And we chose a representative sample. And it was more or less a random selection. We looked at three grade levels, three classes in each grade level, from first form to sixth form. Right. And it was from 11 years old to 19 years old was the sample. And we got roughly 358 persons in total. When we're looking at um, the amount needed, it was 426. But based on the study, we did some calculations, we did some weighting, and we found out what we collected was representative of the school. And so what we did was that we had a self-administered Google Forms, and we went from class to class, and we got them to go to the computer lab where they're able to do the questionnaires. There are many persons who helped in this process. It was a community effort. My friends, friends of friends, my church community really helped to mobilize the team to get it done. And the screening tool that we used were the PH39, which we're looking at in the next slide. This is a patient healthcare questionnaire 9, which is a screening tool for depression. The CRAFT 2+N, which is a screening tool for substance use, and the GASA, which is the gaming addiction scale for adolescents. And this is looking at gaming addiction in adolescents. So just zoning in on the PHQ-9, it was roughly 9 questions for the PHQ-9, and it lasts around 5 minutes. This is something that is free to the public on the 5 websites can be downloaded. It's a great tool. It's used across the board in different populations and in different settings as well. And it shows good sensitivity and specificity for adolescents as well as adults. And so this is a great tool, and you can have a look at it as well. So looking at some of my results, this graph is showing the demographics. So the total I mentioned was 358 that we had, and the largest group was roughly 15-year-olds, between 14 and 16-year-olds. A slight majority were females, and the largest group was in grade 7. So more on the demographics. The overall reported average was 71 to 80%. Approximately 60% of the parents were not married. 43% of the parents, sorry, there's some mistake I have here.
41.
Right, no, yeah, 41% of the parents were married. And 46% lived with their mother alone, and roughly 41% lived with either their mother or father, with 4.7 living with father alone, 3.6 living with grandparents, and 3.9 having some other living arrangements. So looking at the meat of the matter now, on the prevalence of depressive symptoms, and this is something which is considered staggering. A staggering amount, 8% of students reported depressive symptoms, and that is from mild to severe. If you look at the category of moderate, moderately severe, and severe, roughly 46% of those were in that in that category. And why that is important is because, generally speaking, when you are moderate, when you have moderate symptoms to severe, we're thinking that you're not. That's where you possibly may need to be on medication. But generally, what we're saying is that there needs to be some intervention. Whether you have mild symptoms and you need a level of intervention to the point of severe symptoms, you definitely need some form of intervention, and whether that is talk therapy, whether it's going to be seen at guidance counselor, whether it's a family meeting, there needs to be some kind of intervention at this point. And so this is what the results are showing. That's roughly 8% of students reported depressive symptoms. Another thing which was very significant was that for suicidal ideations, when we looked at the PHQ-9, there was a question asking about if you have thoughts to hurt yourself, and 42%, or 44.2% of students reported suicidal ideations. They had these thoughts that they wanted to hurt themselves, and this is thoughts within the last 2 weeks that they wanted to hurt themselves. The PHQ-9 would say whether it is some days, nearly every day, or most days, right? But what we're saying is that this amount, almost 50% of students that we spoke with, that we did the questionnaire with, had these suicidal ideations. And we also saw that the rates are higher compared to pre-COVID data. And so this really underscores that there's a major concern for adolescent mental health, with the suicidal ideations and with the levels of depression that we're seeing. Looking at depression and gender, there was a higher prevalence in females across all categories for depression, and severe depression. For the category of severe depression, it showed that 84% of those persons who admitted to being severely depressed, based on the PHQ-9, were females, right? And this is in keeping with the data generated as well. We're seeing that females across the board have a higher prevalence of depression, as well as prevalence of suicidal ideations, as well as suicidal attempts. Right, and so gender is also a significant risk factor. Looking at the living arrangements, what we found was that living with both parents was a protective factor. as compared to living with either your mother alone, your grandmother alone, or others, and a person in the other category. So living with both parents was seen as protective. And the ones with most severe symptoms of depression were seen in the other category. Looking at the different grade levels, right? So what we saw was that the most severe depression was seen at grade 9 level and also grade 11 levels. And one of the things that we thought about, if you're in Jamaica, I think in the Caribbean, you can think about something which happens at grade 9 academically and something that happens at grade 11 academically. And you have to think to yourself, is this one of the possible inciting factors for the depressive symptoms, right? For those who may not know, in grade 9 is when a lot of the students or most students choose their subjects to do in grade 11. And this is seen as something which is it's a big event, it's a big deal. And you have to do well in your subjects in grade 9 to be able to do the grade 11 exams. And some children may see this as a way of choosing their future from you're in grade 9, because in many cases, if you don't do this in grade 9, you don't end up doing it at all. Or if you have good support, you may be able to pick it up in grade 10. In grade 11. But it's generally a difficult time academically for grade 9 students and grade 11 students. And we're seeing that more severe cases of depression were picked up in these grade levels. And the lowest prevalence of depressive features was in grade 7 when you just entered high school. We saw that's being 32.4%. Looking at internet gaming and substance use, so what we saw was that internet gaming disorder had a link with high depression. And so from the data, one of the things which it came out was that 97% of persons who admitted to having depression were also admitted to having an internet gaming disorder. Right. Let me see if I said that correctly. Of the persons, let me say it again. Of the persons who admitted to having an internet gaming disorder, right? 97% of them were also had depression, right? At varying levels, whether mild to severe. And so what we're seeing is that there is some correlation between internet gaming disorder and depression. And just speaking about it a little more, because I know Marcie wanted to know much more about it. Internet gaming disorder is not currently in the DSM-5. So the DSM-5 is the textbook that's used for mental illness in this side of the world. There's also the ICD, I think it's ICD-11, which is more in Europe. That is European. The DSM-5, which we use in Jamaica, or is more which we use in Jamaica, is American based. The internet gaming disorder is a disorder that is in the ICD-11 right now, and it's a gaming addiction. But it's titled in the DSM-5 as a condition for further study. So we're expecting to see this being a disorder or a registered disorder in the DSM-5, probably in the next revision. I don't know. But what we're saying is that they're doing further studies on it to ensure they have the proper data when talking about internet gaming disorder. But it is something which is in the ICD-10, ICD-11. And also to mention, there's things like the gambling addiction. So the internet gaming disorder scale, which I use, the GASA, it looked at a lot of the things similar to gambling addiction. Yeah. So also what we saw was that the alcohol use increases with the depression severity. So compared to mild to severe, mild did not use alcohol as much as the persons who were sleep depressed, were- who were severely depressed. And so persons who were more severely depressed drank alcohol more compared to those who were not as depressed, right? And this is important to know because there are many cases, I believe it's 1 in 7 cases of persons who take their own life is done under the influence of suicide. Sorry, it's done under the influence of alcohol. And so you find that a lot of persons who die by suicide are also at the point when they die by suicide, maybe intoxicated, or have some kind of alcohol in their system, because alcohol acts as that depressant, but also it leads to you be more impulsive. It decreases what we would say it decreases your frontal lobe, the area of your brain with the critical thinking and reasoning. So it inhibits that section. And many persons die by suicide while intoxicated or under the influence of alcohol. So some of the recommendations that came out of my study was really the need of early intervention, right? Early intervention and screening is needed. Whether we're doing the PHQ-9, which is 9 questions, PHQ